Cortical Vision Impairment by Bria Bose for OTA 2270, Pediatric Conditions Assignment. The definition of cortical vision impairment, or CVI, is a neurological disorder defined as impaired vision due to bilateral dysfunction in the optic radiations or visual cortex. This condition results in unique visual responses to people, educational materials, and the environment. It can be temporary or permanent visual impairment and is caused by the posterior visual pathways and/or occipital lobes of the brain. Etiology of CVI: stroke, decreased blood supply, head trauma, brain malformation or infection, increased pressure in the brain, otherwise known as hydrocephalus, seizure, decreased oxygenation, and metabolic disorders. Some of the different characteristics of CVI are fatiguing from visual tasks, variable or inconsistent visual responses to the same stimuli, difficulty seeing an object or image in a crowded array or a busy background, delayed response when looking at objects, otherwise known as visual latency, preference for familiar objects, or need or preference for movement. Common symptoms include abnormal light response, blunted or avoidant social gaze, brief fixations, intermittent following, poor visual acuity, visual field loss, otherwise known as generalized constriction, inferior altitudinal hemianopic defect. The diagnosis of CVI is a difficult diagnosis to make. It is diagnosed when a child has poor or no visual response and yet has normal pupillary reactions and a normal eye examination. The child's eye movements are most often normal. The visual function will be variable, however. Functional implications. One of the functional implications of children with CVI is that they struggle with focusing on multiple objects or people at once. In addition, they may require educational supports that are equal to those who are considered to be blind or visually impaired. These implications could affect a child's role as a student in that they could potentially not be able to perform at the same academic level as their peers. Impact on development. Current findings show that children with CVI usually have some level of vision that may show some improvement over time as they develop. The degree of vision loss may be mild or severe and can vary greatly, even from day to day. Recent studies have shown that children will go through 3 phases of CVI development. However, the time frame varies across the lifespan. Each phase has unique instructional goals and environmental supports needed. Phase 1, goal building visual behaviors, getting the child to look. Phase 2, goal integrating vision with function. Be aware of environmental adaptations the child requires. Finally, phase 3, goal resolving characteristics. Although promising practices have been identified, consensus had not been reached on the definition, assessment, and services needed to address vision loss of this kind, and much more research may be needed to determine effective educational, rehabilitative, and medical practices in this area. Specific considerations for occupational therapy. Occupational therapy plays a unique role in caring and offering services for children with cortical vision impairment. Occupational therapy is frequently a primary intervention service that is provided when a child has multiple disabilities, specifically to improve the child's ability to play and learn. Many with multiple disabilities present with CVI, and it is critical that occupational therapists address the visual needs of these children to maximize their potential for developing functional skills. Lastly, here are my references. However, I did want to add that occupational therapy can truly help a child with CVI, specifically with creating different activities and therapeutic activities that will entice them to look in one direction. Children with CVI also really love specific colors, so that could be utilized as an OTA. I just wanted to add that at the end of the slideshow just to kind of give you a little bit more of a rundown of specific considerations for occupational therapy. Thank you for watching my video.